A very good evening to all of you. Today we will see the second part of cardiac properties part 2. So for understanding part 2, the understanding of part 1 is very important, and also see the procedure how to stun a frog, how to pit a frog, and how to dissect and mount a frog on the frog board, and also see the instruments which are required for understanding cardiac properties as well as skeletal properties. So we are going to start with cardiac properties 2. So what are the three things which are seen in cardiac properties 2? Nervous regulation of frog, vagal escape, and long refractory period. We are going to study these three things. Nervous regulation of frog. So the nerve supply of frog's heart. This topic is actually explained in very short in journal, so it's very difficult to understand. So we are going to elaborate the topic. We are going to make it a little detailed one. So frog's heart, if we consider the autonomic nervous system, it has two parts: sympathetic and parasympathetic nervous system. Sympathetic nervous system is via the thoracolumbar sympathetic trunk, and the parasympathetic nervous system is via the vagosympathetic trunk. Why it is called as vagosympathetic trunk? Because it has 75% preganglionic parasympathetic fibers and 25% postganglionic sympathetic fibers. That means it has combination of both sympathetic and parasympathetic fibers. So if we stimulate the vagosympathetic trunk, 75% adrenaline will be secreted, or called as epinephrine, and 25% acetylcholine will be secreted. So adrenaline has all positive action: positive, chronotropic, dromotropic, pathmotropic, and inotropic. Okay, means in positive, chronotropic. Chrono means rate, increase rate. Positive, dromotropic. Dromo means increase conduction. Okay, chrono, dromo, ino. Ino means force of contraction, and bathmo means increased excitability. So all positive effects are seen because of adrenaline, and acetylcholine causes all negative effect, means negative rate, negative excitability, negative means decreased force of contraction, and decreased rate. All these things are seen because of acetylcholine. So what are the basics? Heart has its own intrinsic activity, that is, it can generate its own impulse even if its nerve supply is cut. If we cut the nerve supply of heart, be sure heart has its own intrinsic activity. Heart is under the parasympathetic dominance of vagus nerve, which means if we cut the vagus nerve, heart rate will increase, and if sympathetic nerve trunk as well as vagus nerve trunk both are cut, still heart rate will increase. Why? Because it been suppressed by the parasympathetic system always. Above sentences, both 1 and 2, are true for both frog's heart as well as for human heart. And from the last diagram, if we go on the previous page, from the last diagram, we can say that if we stimulate the vagus nerve of frog's heart, 75% PNS, means parasympathetic nervous system action, while 25% SNS, sympathetic nervous effect, will be seen. So how is the procedure? Stunning of the frog. Stunning is by banging frog's head hard on the table, and pithing of the frog, you already know. You pass a needle through the hole which is behind the head, and through that pit, and we destroy the sympathetic as well as the parasympathetic nervous system. And then how we check? We hang the frog and we just gently lift off his leg. The tone of the muscles will be lost, and also we can tap on the eyes. If the frog does not blink, that means that the sympathetic as well as parasympathetic nervous system is being cut, so the frog is properly pithed. Now we mount the frog on the frog board, then dissection of the frog is carried out and heart is exposed. Frog's heart has 3 chambers, 2 atria and 1 ventricle. Okay, unlike human, it has only 3 chambers, 2 atria and 1 ventricle. Lift the frog's heart in such a way that the ventricles come superior. So when we lift the frog's heart, we will see the ventricle comes superior. So there is we'll see how it looks in the next diagram. Now we insert the hook of startling lever in the ventricle and start recording on the drum. Sinus venosus is a pacemaker of heart. SA node is a pacemaker of human heart. So similarly, sinus venosus is a pacemaker of frog's heart. Downstroke on the drum is systole and upstroke on the drum is diastole when recorded on a drum. Okay. So see, this is in BJ Medical College, but if this can be adjusted also. So in some medical colleges, the downstroke is diastole and the upstroke is systole. But in our college, the graph is recorded in such a way, or it was recorded because the practicals have been stopped, that a downstroke is systole and an upstroke in diastole. You know what is a systole? Systole is the phase where heart contracts. Diastole is the phase where heart relaxes. Now in systole, heart contracts and pushes blood. Diastole is heart relaxes and collects blood. So now you can see the ventricle is superior. So when I am lifting up the ventricle, so below the ventricle we have atria and below the atria we have sinus venosus. Okay. So now there are presence of two parasympathetic ganglion in the heart. The first is called as Bieder's ganglion. It is between the ventricle and the atria. Okay. It's not ventricles, it is ventricle. We have a single ventricle. It is between ventricle and atria. And between atria and sinus venosus, there is presence of another ganglion called the Remax ganglion. Now, near Remax ganglion, there is presence of a structure, collection of parasympathetic fibers called as crescent. So that you must remember. So what is preganglionic and what is postganglionic? Now the fibers which are arising from spinal cord and going towards the ganglion are preganglionic fiber, and the fibers which are arising from the ganglion and going and innervating the organ, example heart, is postganglionic fiber. That means in short we can say only the postganglionic fibers are innervating the structure, example heart. For sympathetic supply, the ganglion is more near to spinal cord as compared to the organ, that is the preganglionic fibers are short while postganglionic fibers are long, and vice versa happens for parasympathetic fibers. In parasympathetic fibers, the preganglionic fibers are long while the postganglionic fibers are short. What about frog's vagus nerve? Right vagus supplies sinus venosus in frog, and in human it supplies SA node, right vagus. What about left vagus? Left vagus supplies atria in frogs while it supplies the AV node and atria in human. Ventricles do not have a parasympathetic supply. This is MCQ. Ventricle, both for human and frog heart, do not have a parasympathetic supply. That is the reason why when heart stops for some time, ventricle will be able or is able to generate its own rhythm after some time because it lacks parasympathetic supply. This is one of the reasons of vagal escape. The stimulation of right vagus is more effective than left vagus as it supplies the pacemaker of heart in both frog and human. So if I stimulate right vagus, it is more effective in stopping the heart rather than left vagus because it is supplying the pacemaker of heart. Vagus is not purely parasympathetic nerve. We are talking about frog. It contains 75% parasympathetic fibers but 25% sympathetic fibers, we already know. So how you stimulate the vagus nerve? The vagus nerve is exposed and we pass a glass rod below the vagus nerve, and if I want to stimulate, I will give a shock or I will stimulate with the help of an electrode. I will stimulate or touch the glass rod. I will not touch directly the vagus nerve. Why? Because it's very delicate and it will be destroyed if I give a direct current to it. Parasympathetic supply to the frog's heart. Now, in detail, we'll see the vagal nuclei, which is nucleus, umbigus, and dorsal nuclei of vagus, is situated in the brainstem and medulla. From brainstem and medulla, the preganglionic parasympathetic fibers, they go towards Remax ganglion, and you already know nearby Remax ganglion is situated crescent. Crescent fibers are also parasympathetic. From Remax ganglion, the crescent fibers, which are actually the postganglionic parasympathetic fibers, they arise and they supply the heart. So parasympathetic supply of the frog's heart. Thus we can say that when we stimulate vagus, we stimulate the preganglionic parasympathetic fibers, while when we stimulate the crescent, we stimulate the postganglionic parasympathetic fibers. The postganglionic parasympathetic fibers, that is crescent fibers, supply the heart. Sympathetic supply of the frog's heart. So you can see one is the spinal cord of the frog. From spinal cord of the frog, two, which are the myelinated nerve fibers called as white rami, they arise. These are the preganglionic sympathetic fibers. 3 is the paravertebral ganglion. 4 are the gray fibers, out of which 75% are postganglionic sympathetic fibers, which go and innervate the heart, which is 5. But 25%, which is shown by the arrow, and number 6, these are the postganglionic sympathetic fibers which go and join vagus nerve. So since they are going and joining vagus nerve, hence the vagus trunk is called as vagosympathetic trunk. Now we will see the first graph of vagal escape. Now what is the basics? Whenever the vagus nerve or crescent fiber is stimulated, heart will stop in diastole due to secretion of acetylcholine. The detailed mechanism of action of acetylcholine will be taken in cardiac properties 3, where we are going to take drugs. So the only difference in vagal and crescent stimulation is that when we stimulate both are going to secrete acetylcholine, because of which heart is going to stop in diastole. But the only difference is that since crescent is deeply situated, it will pull the writing lever little down, and there will be an artifact which will be produced as shown in the next diagram, which is A. And what is B in the next diagram? B shown in the diagram is beneficial effect, and it is due to gradual hydrolysis of acetylcholine by cholinesterase, and thus cardiac activity returns to normal. So now this is a graph showing vagal escape. This is how you explain a graph. This is a graph of an amphibian heart demonstrating the property of vagal escape. So what is happening? On the top you see a line with 2 marks. That mark is a point of stimulation. So this is actually the EMTM, electromagnetic time tracer, okay, or time marker. So now what we do, you can see the normal activity of heart. Normal activity of heart has been written on by the lever on the drum, and this drum is moving. Okay, it is a moving drum. So at point A we stimulate the vagus nerve. Okay, when we stimulate the vagus nerve, you can see the heart stops in diastole. Okay, when the heart stops in diastole, after small stoppage, okay, when we remove the stimulation, again the acetylcholine secretion stops. Okay, when this is the not a graph demonstrating vagal escape, this is a graph showing vagal and crescent stimulation. Okay, so in property of vagal escape, first we have to study this graph, then we have to study the graph of vagal escape. So this is very simple. Here we are not continuously stimulating vagus nerve, we are stimulating vagus nerve for some time. Okay, so first A, you can see in A we are stimulating the vagus nerve, and when we stimulate the vagus nerve, what is going to happen? Heart is stopping because acetylcholine is secreted. After that, heart resumes its activity, but eventually, not immediately, eventually means gradually, because of there is hydrolysis or destruction of acetylcholine by cholinesterase enzyme. Okay, so you can clearly see that arrow is pointing towards beneficial effect, and A is when we stimulate the vagus nerve. B is a point where we stimulate crescent. Now crescent is also parasympathetic fibers, so acetylcholine is going to be secreted, but since it is situated deeper, what we will see, because it is situated deeper, there will be an artifact form, and also because of the artifact form, you can see the arrow is pointing, B is pointing towards that artifact, and also the heart stops for some time and then regains its activity, showing a beneficial effect. Okay, so this is a graph which is not pointing towards vagal escape. Later of our understanding vagal escape, this graph is very important. It is pointing towards vagus and crescent stimulation. Okay, so luckily we don't have right and vagus stimulation and crescent stimulation. We have only this graph, which is vagus stimulation and crescent stimulation. Okay. So now there comes the graph of vagal escape. Now you understand what exactly is happening by vagus and crescent stimulation. Now what we will do, here we are going to take EM-TM in circuit. Last time also we had taken EM-TM in circuit, and here we mark the point. The use of EM-TM is to mark the point of stimulus, and also we are going to take Neves hammer in circuit to give continuous stimulus more than 30 per second. So if stimulus more than 30 per second has to be given, we have to take Neves hammer in circuit. So you can see this is the EM-TM, and in the next diagram what you see is the to which the coils, small two coils are been attached. That's the Neves hammer. So what we are taking in circuit, we will see when we study instruments in detail. So what is happening, first we record the normal cardiogram, and at the EM-TM point, here there is no marking on the graph. So at this point you can see we start stimulating the vagus, and we are continuously stimulating the vagus. We are not stimulating and remove, we are continuously stimulating the vagus, and because of continuous secretion of acetylcholine, heart stops for a while, but heart cannot stop for long time. Hence after some time the ventricles start producing its own rhythm, and this is termed as vagal escape. Okay. So now the ventricles are producing its own rhythm, and after some time we stop the stimulation of vagus now, and after that, showing a beneficial effect, heart regains its original activity. Now what is definition of vagal escape? The escape of heart from inhibitory effect of continuous vagal stimulation is called as vagal escape. Causes in pit animal, example frog, or in an experimental animal, what are the causes? First is idioventricular rhythm. That means what? Ventricles generate their own rhythm, as ventricles lack parasympathetic nerve supply, but the rate and force of contraction is slower. Okay, so you saw already the rate and force of contraction was less. Depletion of acetylcholine either by destruction or by exhaustion. So you already know, if I continuously stimulate the nerve ending, what will happen? There is decreased secretion of that neurotransmitter, that is exhaustion. And destruction, you already know, destruction of acetylcholine is by enzyme called as cholinesterase, which is present in the frog as well as humans. Vagosympathetic trunk, we already discussed that, because if we are stimulating the vagus now, that means we are stimulating vagosympathetic trunk. So 25% of epinephrine, that is adrenaline, also secreted, which is going to show a sympathetic effect. Tachyphylaxis. Repeated stimulation gives reduced response. This is due to dearrangement of the receptors. This is also one of the reason why vagal escape in experimental or pits animal. Now, what are the causes of vagal escape in non-pits animal, or how we can say that how the human body tries to recover from shock? You already know what is the definition of shock. Shock is reduced blood supply to the body by any reason. The blood supply is so low that it is not able to perfuse any of the tissues, and ultimately it is going to cause hypoxia. So how body tries to fight against shock, or what are the various compensatory mechanisms body is going to take place in shock, and how this can be proved, or how this can be extrapolated, clinically correlated to shock. How this graph can be clinically correlated to shock, we will see. So heart stopped in diastole, more amount of blood is accumulated in heart, stretch receptors are being activated, and this when stretch receptors are being activated, the heart rate increases. This is according to a reflex called as Bain-Bridge reflex. Second thing, heart stopped in diastole, there is sudden drop in blood pressure. When there is sudden drop in blood pressure, it is detected by baroreceptors, and heart rate is increased by Mary's reflex. There is one more reflex called as Mary's reflex. Means decreased blood pressure increases the heart rate, is called as Mary's reflex. Okay. Clinical implication, heart does not stop for longer period of time. It launches various compensatory mechanisms and also generates its own rhythm in an effort to maintain blood flow to the vital organ. So this is how you apply the graph of vagal escape clinically. Okay. Long refractory period. So what is, first we see some definitions. Refractory period, time interval during which a normal cardiac impulse cannot excite a already excited tissue, is called a refractory period. Means uh, the heart is already running. So if the heart is in refractory period, any stimulus I apply to the heart, it is not going to produce any response, but that is in absolute refractory period. In relative refractory period, if I apply a supra threshold or stronger stimulus than normal, the heart will show some response. Okay. So what is absolute refractory period? During this, cardiac muscle do not respond to any strength of stimulus. What is relative refractory period? During which cardiac muscle respond but only to suprathreshold stimulus. So clinically, we will see first graph, extrasystole and compensatory pause. So first we will see, you can see the normal cardiogram being located. M is the make and B is the break. So usually in B, the break is more than make, means the strength of stimulus of break is more than that of make. Why? Because the rate of change of magnetic flux is more in break rather in make. Okay. So when we give make, heart is giving response, normal response. We are recording normal for cardiogram. And in break, A, okay, A is a stimulus. The current of stimulus is equal to make. B, the current of stimulus is equal to break, but that is given during diastole. Hence, some kind of response is been seen. And after that, C is a compensatory pause. Means heart is pausing for a while after showing a suprathreshold or the extra response or a premature response. Okay. So now what we will see, why extrasystole and compensatory pause is seen, what exactly they are. So what is extrasystole and describe its cause? Extrasystole is actually a premature beat which has come before the normal impulse because we have applied suprathreshold stimulus during diastole, and diastole of the heart is relatively refractory. Application of any strength of stimulus or current during systole will have no effect because the period of systole is absolutely refractory. So I have already told you that if we apply current in diastole, that of suprastant stimulus which is happening during break, because the strength of break is more than that of make, the graph is going to show a response. Okay. But if I apply any strength of stimulus, any strength of current during systole, nothing is going to happen. So why extrasystole is followed by a compensatory pause? After extrasystole, heart waits for the next normal impulse to arrive from sinus venosus, hence takes a pause which is called as compensatory pause. Why compensatory pause is beneficial to the heart? It maintains the normal rhythm of the heart. Why contraction which follows the compensatory pause is of greater amplitude? It was not properly seen in the graph, but usually after compensatory pause, the contraction which is seen of greater amplitude. Now during the compensatory pause, heart gets extra time for filling of the blood in the ventricles, and hence according to a law called as Frank-Starling law, the force of contraction is directly proportional to initial length of muscle fiber. So if the force of contraction increases, so if the initial length of the muscle is more, force of contraction is more. And when will be the initial length of the muscle more? When the fibers of the heart will stretch. And when the fibers of the heart will stretch, when the end diastolic volume or the volume just before the contraction, means at the end of diastole, if the volume of blood is more, which is because of the compensatory pause, the force of contraction will be more. Is compensatory pause seen in any patients clinically? Yes, compensatory pause is seen in patients with ectopic pacemakers because there are 2 or 3 pacemakers. So compensatory pause will be seen. Chronic tobacco chewers and patients with severe anxiety also show compensatory pause. Now the second graph, effect of 2 successive stimulus. So before starting this graph, you have to just remember one thing, that the entire diastole shows relative refractory. That means the strength of the stimulus, if greater than that of the threshold stimulus is given, it is going to show some kind of response. But the systole, entire phase of systole is non-refractory. So what is the procedure? Procedure same as all of the above experiments. Additionally, take EM/TM in circuit. Also make the heart quiescent. Quiescent means you have to stop the heart by applying a mid-atrial ligature. Drum used for recording is a slow moving drum. Now you have to record on a slow moving drum. So you can see this graph, it is the recording of the graph on the slow moving drum. Now we are 1, 2, 3 and 4 we are stimulating during various phases of diastole, and the fifth we are going to stimulate or give current during systole. So first you can see the stimulus is been given after relaxation, means before contraction but after diastole. Okay, the point where diastole is over and systole is going to start, we are going to give at stimulus at that point. It is showing some response, and you can see the response is in all 1, 2, 3. Okay, it is slightly larger. Okay, the response is slightly larger. So you have already seen that property that because of the extra systole premature beat, a larger response is seen. Okay, so what is important, that after relaxation, that is 1, we give a response, we give a stimulus and we see a response. In 2, we give a stimulus during late relaxation, again we see a response. In 3, we give a stimulus during mid relaxation, again second response. 4, we give a stimulus in the early relaxation and we get again a response. But 5th, during contraction, when we give stimulus during systole, heart shows no response. So why is the second stimulus falling during systole not effective in initiating any response? You already know the answer. Because the systolic phase of the heart is absolutely refractory. Third and the final graph is incomplete tetanus. The procedure same as all of the above experiments. Additionally take EM, TM in circuit, and also here we have to make the heart quiescent, that is stopping the heart by applying a mid-atrial ligature. So you have seen that the graph of incomplete tetanus, this is from the journal. So above you can see the line of EMTM. Now we start stimulating. Okay, so we first see, so we are stimulating at the above point. So now we stimulate. Okay, what we are stimulating? We are continuously stimulating the heart muscle, and we are getting a saw-shaped response, okay, which is marked as 9 in the graph. Okay, and when we release the stimulate, this is a slow moving drum, and when we release the stimulus, the heart regains its original activity. It is since the heart is been quiescent, that is we have actually stopped the heart, and this is a slow moving drum, it shows a thin line. Now what is this property of incomplete tetanus? Okay, heart muscle should not tetanize, you already know. Okay, skeletal muscle do tetanize, but heart muscle should not tetanize. So what exactly is this saw-shaped structure which you are getting on this graph? So this saw-shaped structure is actually called as incomplete tetanus. Cardiac muscle cannot be thrown into complete tetany due to its long refractory period. Only phase of diastole exhibit relative refractory period and shows some response with suprathreshold stimulus, while systolic phase does not show any kind of response as it exhibits absolutely refractory period. So there are periods of incomplete relaxation between the responses. This is termed as incomplete tetanus. That means the phase of diastole is showing response, but the phase of systole is not showing any kind of response. So the incomplete relaxation phase, relaxations are appearing on that graph, saw-shaped structure. So this is a graph of incomplete tetanus on a slow moving drum on a quiescent amphibian heart. So why does heart have a long refractory period of around 250 to 300 milliseconds in both frogs and human? To avoid fatigue, to avoid tetany, to maintain circulation to the body, to ensure complete filling of atria and ventricles before they contract. Heart gets enough time to recover. ensures that there is no overlapping of the heartbeat. Heart should not beat repeatedly twice, or should not beat abnormally, or there should not be any abnormal rhythms. To avoid that, refractory period ensures that heart gets enough time to recover and also ensures that there is no overlapping of the beat. So now these are the video links for today's lecture. Feel free to watch the video links. Thank you.